Hello students, welcome back to Community Health Nursing. Myself, Lija Matthew. Let me ask you one question. We all are following so many topics day by day. Almost we are going to an end of our syllabus even. Only 2 more units are there to complete. So how many of you used to write the topics taken per day by putting the date, how many subjects has been taken, which all subjects by which madam has been taken, how many of you write in your notebooks, in your rough book as a proper timetable? Because I have advised this thing to my mentees, and I was so happy that they were following this from the day I have told, which helped them a lot. So from today onwards, I would wish all of you to put the date on the particular topics which are covered. So like today we are going to study about National Vector-borne Disease Control Program. So you have to open the KPAR textbook, find out the particular topic and put today's date. And after listening to my lecture, you have to read that particular content. While you attend my lecture, I never force you to write. No need to write the lecture. No need to take pen and pausing the video and writing. You just listen to me, what I am telling, what I am explaining. Because I am following Shyamala D. Manivannan textbook. In that, it is very clearly given point-wise. The same things, even in a more depth, it is given in K-Park. So there is no need for you to worry about the content. Even this video is also always there with you in the link form. You can see it again if you wish. So once you listen, then you open your textbook, put particular today's date near to that content. Then you should read that particular program once. Then it will really help you out a lot. Because it is not about how many of you give attendance, how many of you just listen to my video. It is all about how much you remember these things for your final exam. How many of you really follow the syllabus of community health nursing. It is much important. So for your benefit, again I am telling, after listening to the lecture, you have to follow the same topic in K-Park. You have to read once. You just read. During reading, you can underline the important things whatever I have emphasized in my video. So today, let us start with National Vector-borne Disease Control Program. So already we have covered 2 national health program, which are the National Acute Respiratory Infection Control Program we have covered, and then we have covered about RNTCP, Revised National Tuberculosis Control Program. So in that already I have given a review also about tuberculosis, because tuberculosis is very much important. In that DOTS treatment can be separately asked for 5 marks. They can ask about the role of nurse in RNTCP program. All these national health programs they can ask either in the form of what is that national health program, what are the strategies, what are the aims and objectives, and even they can ask individually for 5 marks what is the role of nurse in each of these national health programs. So whatever plannings, whatever they are implementing, it is all through the nurses only or through the health professionals only. So let us start National Vector-borne Disease Control Program. So in India, the Directorate of National Vector-borne Disease Control Program is the central agency for the prevention and control of all the 6 vector-borne diseases. Which are they? They are malaria, dengue, lymphatic filariasis, kala asar, JE, that is Japanese encephalitis, and chikungunya. So actually the Directorate of National Vector-borne Disease Control Program, they actually plan the things. They make the policy making. They technically guide and evaluate the program and the implementation of the program. So among these 6 vector-borne diseases, we all know that all the diseases are transmitted by mosquitoes except Kala Asar. Kala Asar is transmitted by a sand fly. All the others, the vector is mosquito. So it is a very long program because all the 6 of these programs are compiled under this one heading, that is National Vector-borne Disease Control Program. So let us see the prevention and control strategies of vector-borne disease under this particular program. So these things are common, so that you can see that for all the things, whatever they are doing as the preventive and control strategies, there are important strategies listed under 3 broad headings to tackle the problem of vector-borne disease. The 3 main objectives are: first one is integrated, accelerated action toward reducing mortality of malaria, dengue, and Japanese encephalitis by half. So the cases should be, at least they have to bring down the 50% cases or a reduction in the mortality, especially related to malaria, dengue, and Japanese encephalitis. Then this program has aimed us at the elimination of Kala Azar by 2010. By 2010, they would aim at the eradication or the elimination of Kala Azar. Then the elimination of filariasis by the year 2050. So we are now in 2020. So let us see how much they were able to attain and what was the succeeding part of National Vector-Borne Disease Control Program. So when we are looking into the main 3 things I have told you, so let us see what are the main 3 strategies what they have followed for the prevention and control aspect. So for the prevention and control of vector-borne diseases, the various strategies are like we'll start from the upper side. The first one is like disease management, early detection of the cases, and we should complete the treatment. There should be compliance with the treatment. What do you mean by compliance with the treatment? The regular treatment should be taken. And referral systems, in case of any emergency or complication, we should have a good referral systems. Then epidemic preparedness, if it is transmitted to others very fast in a particular community or in a village or in a particular area, so that epidemic preparedness we should have. Like in disaster management, we all know, we have already studied under disaster management, when a disaster, if it is coming in the form of an epidemic, how we have to be prepared. Then rapid response, how we can rapidly respond towards a particular spread of infection. Then the other strategies are supportive interventions. The various supportive interventions are behavior change communication, capacity building, and intersectoral coordination. As we all know, these 3 things are very much needed as a part of the intervention for the prevention and control of a vector-borne disease control program. They have to change their behavior, like waste disposal, so that the breeding of the mosquitoes can be prevented a lot. And the capacity building, like people should have good immunity, and they should maintain their own personal hygiene and environmental sanitations, and all the intersectoral coordinations, like purification of canals, closed drainage system, the water, the environment, the health sector, everything should really work together. And the integrated vector managements, like indoor residual spraying. As we all know, like these vectors, like mosquitoes especially, we have to reduce them. The one way is indoor spraying. We have to spray the medicine for them. Then impregnated bed nets. So like we should have insecticide treated bed nets. So like we used to tell it as ITN, insecticide treated nets. So we have to use such type of bed nets. And larvivorous fish, that means the anti-larva treatment. The anti-larval approach is by giving fishes, like for example guppy fish. So through the PHC and the CHC, especially in the CHC, they have a program under this vector-borne disease control program. They used to supply guppy fish, because this fish eat the larva of the mosquitoes, so that the larva of all the mosquitoes will get die, and there will be reduced breeding of the mosquitoes. So wherever water is stagnated, they used to put the particular larvivorous fish, that is the guppy fish, one example is. Then source reduction, so wherever this particular breeding system, or wherever the source of the mosquitoes, we have to reduce that by proper environmental sanitation. So these all are the main preventive and control strategies which they used to take for all this vector-borne disease controls. So which are they? Like for malaria, dengue, filariasis, Japanese encephalitis, and even chikungunya, because these all here the vector is the mosquito. Then only thing is kala asar. Kala asar, the vector is the sand flies. Even for them also the same things. All this vector management can be used. So let us start with the first one, that is malaria control program. So under malaria control program, we can see that it has been launched during the first 5-year plan, that is during 1953. The increased success rates motivated India to convert the program into eradication program. So this program has been later changed to eradication program. Let us see in the following flowchart. We will be discussing what are the historical events or highlights of malaria control activities in India. So when we look into the malaria control activities in India, year wise it is very clearly given the activities. I'm not going to dictate this. You can read it very clearly each year what was the activities the government has given. So only at least you should try to by heard some of the highlights, like in 1953 they have launched the national malaria control program, and in 1958 national malaria eradication program is launched. Then the urban malaria scheme has been launched in 1971, and then we can see that in 1995 modified action plan for malaria control has been implemented. Then in 1999, it has been renamed, the renaming of program to National Anti-Malarial Program. So it has been renamed to Anti-Malarial Program, National Anti-Malarial Program by 1999. And we can see that by 2002 it has been integrated. So integration of malaria control program with the national vector-borne disease control program. So malaria control program vector-borne disease control programുമായിട്ട് ഇൻ്റഗ്രേറ്റ് ചെയ്ത ഇയർ 2002 ആണ്. So like this few of the things you can remember. If you are not able to remember everything, at least whatever I have read, the important things you can really by heart. Why I am telling is not only for your syllabus sake, I would like to tell you that you are final year students. So by coming year you will be appearing for so many competitive exams, maybe for your MSc entrance exam, maybe for a government test, so many staff nursing or teaching levels. So when you attend this type of competitive exam, you will be seeing there will be much objective questions or multiple choice questions, especially from community side. So you have to study very well about the national health programs, because it is all about the general knowledge, how our Indian economy or how our Indian health system, what are these things going on and how it is getting implemented. So you should have a general knowledge about all these particular things. So at least few of these dates you should try to recall. Then we can see that even by 2013 a new drug policy itself has been came for the malarial control program. So these are some of the things you have to highlight. So let us see further. Let us enter into the activities. So the main activities what you can see in the anti-malarial program is the formulation of the policies and guidelines. So they used to set the various policies and guidelines, the technical guidance, so how it can be reduced or how it can be eliminated. So the eradication program, so it needs a lot of technical guidance like statisticians, all the piling up or the compiling of all the reports, all the statistical informations, then the planning, the logistics what they need for this particular program, monitoring and evaluation. So these all are the main activities. Then coordination of activities through the state and union territories and in consultation with National Center for Disease Control and with NIMR, that is National Institute of Malarial Research. So I would like to tell you one more thing here. There are so many terms which we used to study in community, expansion of so many things. So hereafter, whenever somebody is telling what is NCDC, you should be able to recognize that what is NCDC, National Center for Disease Control, and NIMR is National Institute of Malarial Research. So NCDC, the National Center for Disease Control, they all have a high role in controlling all the communicable diseases. So really we should know about, because the activities through the state and union territories, they used to get coordinated through this particular institutes. Then collaboration with international organizations such as WHO, World Bank, GFATM, and other donor agencies. So we all know that there are so many international health organizations and even donor agencies like voluntary health agencies who give their financial support, not only financial, even logistic support also. So WHO, you all know, World Health Organization, World Bank also we have studied. What is GFATM? So whenever you get such type of words, you should enter into the online and you should type and see what is the expansion. So if you have any doubts of such things, after the class you should write in a paper, or whenever you are getting such type of terminologies, if it is a new one for you, you should start writing in a book, so that at the end of the year it will give you fund of knowledge. Not only in community subject, I am telling, in all the subject, especially in community subject, you will get so many things, especially when we go through all this national health programs, there will be so much of expansions. So what do you mean by GFATM? GFATM means Global Fund to Fight Against three diseases, which are the Global Fund to Fight for AIDS, tuberculosis, and malaria. So what is GFATM? Global Fund to Fight AIDS, tuberculosis, and malaria. That is GFATM. So this international organization also, they collaborate the work of the malarial activities. Then training is also very important for the anti-malarial work. Then facilitating research through NCDC. What is NCDC? National Center for Disease Control, and NIMR, National Institute of Malarial Research, and even the regional medical research centers also, and coordinating the control activities in the interstate and inter-country border areas, because since it is an epidemic, so we have to think about not only our state, not only our country, we have to think about the interstates, between two states and between two countries, because see, even a minor issue can bring up a very large problem into even the political level, which can lead to many type of fights and even war itself. So we have to coordinate the control activities so that the spread can be minimized through interstate and even inter-country border areas. So let us see the strategic action plan for malaria control in India. So in India, like 2012 to 17, let us see what are the strategic plannings. So as the vision of this particular program, they were as a short term and a middle term goal, they were trying to reduce the cases of malaria, and as a long term they would like to eliminate the malaria, when new tools in combination with strengthening of health system will make national elimination possible. So that all the by strengthening various health systems, like we used to see, like first referral units, by strengthening the PHC, CHC. So all these things we are doing in order to eliminate many diseases from our community, so that it can be possible. The malaria control is incorporated under the umbrella of NRHM also, National Rural Health Mission. Even under that program also, the malaria control has been incorporated. So the main objective is to achieve the API less than 1 per 1,000 population by the end of 2017. So when you go through a KPAR textbook, you will be able to see API. What is API? Annual Parasite Index. So annually the parasite index, this malarial parasite should be less than 1 per 1,000 population by the end of 2017 was their particular objective. And the goals what they have set for that is screening all fever cases suspected to malaria. They have to screen all the cases. They have to go for the microscopic examination and even for the other diagnostic evaluations, and testing all the Plasmodium falciparum cases with full course of effective ACT and primaquine. So what do you mean by ACT? ACT means it is a combination of medicine, that is ambroxol hydrochloride and cetirizine hydrochloride, which is especially used for allergic rhinitis and productive cough. So it's a sort of treatment. It's a treatment combination of two drugs, ambroxol hydrochloride and cetirizine hydrochloride. So you can just remember like this: the testing of P. falciparum. What is P. falciparum? Plasmodium falciparum. So especially we can see that there are two strains we used to see, P. falciparum and P. vivax. So even P. vivax, it causes recurrent malarial incidents in a particular area. So if there is these two strains, we have to provide the treatment with this particular medications, and even we have to make it sure that they all are taking this particular medications. Equipping all health institutions, especially in high risk areas. So in the high risk area especially, we have to see for the all the special treatment should be there available in the high risk area in the health institutions. Then strengthening all the district and sub district hospitals in malaria endemic areas. In all the malaria endemic areas, wherever malaria is more prone, we have to strengthen the services, especially in the district hospital and in the sub district hospitals. So the outcome indicators are at least 80% suffering from malaria get correct, affordable, appropriate and complete treatment within 24 hours of reporting. So once the case is reported, within 24 hours they should be able to find out where is the first case, from where it came, what is the real cause, and the proper treatment. Everything should be accessible for at least 80% from those who are suffering with malaria. Then the other thing is, at least 80% of them, those at high risk of malaria, get protected. So at least they should get protected so that the spread can be reduced, and at least 10% of population in high risk area is surveyed annually. So these are the three outcome indicators what they tell. So in the outcome indicators, the first one was at least 80% of malarial suffering cases should get the complete treatment within 24 hours, and 80% high risk should be protected from the spread, and 10% of population high risk areas should be surveyed. The survey should be done annually every year, and we should be able to find out if there is any risk factors in particular population. So these are the outcome indicators what they have planned for the malaria control program under 2012 to 17 strategy. So in the malaria control strategy, let us see what they have further done. So one is the surveillance and the case management. So as I have told, I hope you all know the word meaning surveillance. So especially in case of vector diseases, we have to do active surveillance. What do you mean by active surveillance and passive surveillance? Active surveillance means we have to go into the particular field and find out where are the malaria prone cases. So case detection, passive and active should be done. Passive means the people will be coming to the hospital by various symptoms, and from that we have to find out the malaria as early as possible, and we have to further do the preventive measures. So active and passive surveillance, case detection should be done, early diagnosis and complete treatment, and this type of thing should be more focused for the case management purpose. Next is the integrated vector management. So when we were telling about vector management, what we can do in the already we have seen the preventive strategies of vector-borne disease. In that we have seen the indoor residual sprayings can be done. We can use insecticide treated bed nets. We can use long lasting insecticide nets. So these terms you should IITN. LLIN. What is LLIN? Long lasting insecticide nets. So these type of things can be used for the integrated vector management, and anti-larval measures in order to reduce the source. Like as I have told, anti-larval fishes can be used. Then the epidemic preparedness and early response, or let us see the supportive intervention. The same thing we have seen in the tabular column just before. So the capacity making, behavior change, communication, that means we have to make the people aware about, we have to health educate them, how they have to change their lifestyle, how they can change or modify their behavior towards sanitation, environmental sanitation. Some people, they used to think that if they take bath daily and if they clean their own houses, they are safe forever. No, they just dump the waste near to their houses, they just throw it here there in their villages. They are not aware that the vectors come from there and they enter through the windows into their houses also. So this type of behavioral changes, we should make them through good communication, and intersectoral coordination is very much needed. Monitoring and evaluation of the programs is needed, and operational research and applied field of research is also. We should do so much of survey, we should search and research, so that we will finally get the answer for many of the questions. Why still malaria is prevalent in some of the areas? So such type of research activities, survey conduction, everything should be done. Then let us see what are the mosquito control measures. So in the preventive measures, which include the anti-larval measures. In the anti-larval measures, I am very sure that you have studied all these things in BSc second year also. So I don't want to again make you bored by telling these type of things. So if there is any stagnated water, very well you all know that we have to put at least 1 drop of kerosene or 1 drop of oil over the stagnated water. And this type of, and the other is the ആൽഗെ, നമുക്ക് അല്ലേ, നമുക്ക് പായലുകൾ അല്ലെങ്കിൽ ഇതുപോലെയുള്ള വെള്ളത്തിൻ്റെ മുകളിൽ പൊങ്ങിക്കിടക്കുന്ന പായലുകൾ നിങ്ങൾ കണ്ടിട്ടില്ലേ? സോ ദീസ് ഓൾ തിങ്സ് ഇറ്റ് വിൽ അവോയ്ഡ് ദ മോസ്കിറ്റോ ടു കം ആൻഡ് ബ്രീഡ് ഇൻ ദ സ്റ്റാഗ്നേറ്റഡ് വാട്ടർ. സോ അതുപോലെയുള്ള പായലുകൾ, അല്ലെങ്കിൽ ഓയിൽ, 1 drop ഓഫ് കെറോസിൻ അല്ലെങ്കിൽ 1 drop ഓഫ് ഓയിൽ, അല്ലെങ്കിൽ ആൻറ്റി ലാർവൽ ഫിഷസ്. സോ ദീസ് തിങ്സ് ക്യാൻ ബി യൂസ്ഡ് ഫോർ ആൻറ്റി ലാർവൽ ആസ് ദ ആൻറ്റി ലാർവൽ മെഷേഴ്സ്. ആൻഡ് ആൻറ്റി അഡൽട്ട് measures like residual spraying of DDT can be sprayed, or malathion or phenitrophion against the adult mosquitoes. So this type of residual sprayings can be used. So these three are the example for the medications used for residual spraying. So I hope you all know what is DDT. So if any of you don't know DDT, now only you should write in the page of the K-Park or in your rough note, or where you maybe you all have a notebook to maintain the running notes of community. So in that particular community running notebook, you have to write what is DDT. So what is DDT? Can anyone recall? It is dichloro diphenyl trichloroethane. What is DDT? Dichloro diphenyl trichloroethane. DDT can be sprayed, or malathion can be sprayed as an residual purpose, and otherwise we can use phenitrophion. So these are some of the examples of the spraying which we can use against the adult mosquitoes. And space application of pesticides in the form of fog or mist. So even we can use some of the pesticides also. So these are some of the anti-larval measures. Then next is protection against mosquito bite. So mosquito bite also we can protect ourselves by using protective clothing, full sleeves. We can use full sleeves by covering our body parts. Even especially in the evenings, parents used to tell mosquitoes will come, so suddenly close the windows. Then we can use repellent creams, mosquito repellent creams we can use, mosquito net we can use, mosquito coils, or screening the houses by small mosquito nets we can put in the windows of our houses, mosquito mesh in the windows and doors. So these are some of the protective measures against mosquito bite. So let us see the reduction of mosquito breeding sites, how it is possible. Already I have told, like promoting proper drainage system. We all should have closed drainage system. There should not be any stagnation of water, and there should be proper management of water level, like if there is a drainage system, or we can see the sealed toilets or latrines, so the water level should be maintained, and the changing of salt content of water. So like a chlorination of the waters, then keeping the water coolers clean, so that they should not breed there. So if there is any opening for your water coolers, we have to clean it, and we have to avoid the breeding. So such type of cleanliness factors we should recommend for the reduction of mosquito breeding sites. And the final part is last but not the least, you all should remember health education has much effect. The community should be educated on what is the cause, spread and prevention and management of malaria. The individual, group or mass educations can be given. And the integrated approach, like in present days world attempts are being paid on bioenvironmental and personal protective measures, which are known as integrated vector control methodology. So integrated approach means personal protection along with bioenvironmental approach. That means environmental changes. So we have to personally protect ourselves, we have to change our behavior. At the same way, we have to make our environment naturally. That means we should not misuse the environment. So we have to maintain the proper bio environment along with us. So this is an integrated approach so that we can control the malarial cases. So let us see National Malaria Control Program under Vector, how it has been. So already we have seen that it has been integrated to National Vector-borne Control Program. In which year it has been integrated? In 2002. In 2002 it has been integrated to Vector-borne disease control program. So under that, what was the role, what all they have done? So this plays an important role in controlling the malaria. This functions according to the strategies and goals set in the program. The diagnosis and treatment of malaria as per the Vector-borne control program, let us see. So in that, the suspected malarial cases, and we have to do the microscopic examination within 24 hours, and we can see that what is the treatment. Already I have told, like if it is Plasmodium vivax positive, if it is Plasmodium falciparum positive, what are the treatment measures they have given. And this is the diagnosis and proper treatment of malaria under National Vector-borne Disease Control Program. So let us see what is the role of a community health nurse in caring malaria. So here comes, see, all the national health programs, do you think that whether it can be implemented without the help of a community health nurse? No. So community health nurse has really a very big role in all in controlling all these communicable diseases or in all these national health programs. So in malaria program, let us see. First one is monitoring of vital signs for all cases attending the subcenter and PHC. So she has to find out the passive surveillance. See, if any cases is coming, they have to find out, monitor the vital signs of the cases which is attending the subcenter and the PHC. No single fever case should be ignored. So even though if they are coming for a simple fever case, they have to suspect a malaria case can be, it can be. So it should not be ignored. Thin and thick blood smears should be done and dispatched to lab, so the malarial slides should be taken. So the thin and thick blood smears should be taken and made in the slide, and for the further examination it should be sent to the laboratory. While waiting for the report, start the person on presumptive treatment. So like especially if they show some symptomatic symptoms, we have to start the preliminary treatment till the result comes. And the other thing is, avoid starting treatment on an empty stomach. For when we treat for malaria, or whatever it is, we have to ask that whether they have taken the food. If the patient is empty stomach, we should not start the treatment. The first dose should be given under observation. So the first dose for the anti-malarial drug should be given under observation. Provide health education to the individual and family about malarial fever. We have to make them aware that how the malarial fever look like, and we have to educate them how we can recognize it. Then advise to have plenty of water. Then after administration of the oral anti-malarial drugs, observe for any vomiting. Some people, they have sudden reactions like vomiting. Repeat the dose if vomiting occurs within half an hour of intake of anti-malarial drugs. That means the drug has came out in the form of vomitus, and we should repeat the dose again. Then IV fluid should be started for those who are unable to tolerate anything orally. Some people, they will be having severe vomiting in case of malaria, so severe vomiting along with fever. So in such cases, IV fluid should be started. Any patient complains of drowsiness, then immediately we have to refer to hospital in necessary for further diagnosis management. So if any person is complaining you during the home visit, or when you go for the village visit, if they are telling about drowsiness along with this fever, vomiting, all these things, we have to refer them immediately to the hospital. And further follow up of the family is also very important. If one particular case is identified in a particular place, then of course they have to make sure that they have to do the follow up with the family, whether the other family members are having the same malarial symptoms, or the nearby houses how they are, or the whole village. They have to randomly take the sample and they have to check for the malarial strains. So this is all about anti-malarial program, or the National Malaria Control Program, which comes under Vector-borne disease control program. So in the coming class, we will be continuing with the other things also. If I take all the 6 today, then maybe you will start hating the national health programs. So under the National Vector-borne disease control program, today we have discussed about the anti-malarial control program. In the coming class, we will be discussing about the other vector-borne disease controls. Thank you, students.